A 71-year-old patient once sat in my office and said, "Doc, I've been doing it the same way for 50 years, but lately something feels off." He wasn't sick, wasn't on new meds, but something was quietly harming his body. Masturbation, not the act itself, but how he was doing it. It was affecting his heart, his prostate, even his ability to feel. I'm Dr. John Smith, a urologist with over 30 years of experience, helping men over 60 stay strong, keep their blood flowing, and feel confident without shame pills or guesswork. You've probably heard masturbation is healthy, and it can be, but after 60, some private habits can silently turn harmful with no warning signs. I see it every day in my practice, good men struggling because no one taught them how their aging body needs different care. Done wrong, masturbation can sap your energy, hurt your performance, or even disconnect you from yourself. Done right, it can boost testosterone, improve sleep, and keep your circulation strong. Today, I'm going to walk you through 7 mistakes older men make when masturbating and how to fix them before they impact your health, your stamina, or your life. Mistake number 6 is one almost every guy gets wrong, and it could change how you feel for years. Stick with me, these insights could shift how you live your next decade. If you haven't subscribed yet, hit that subscribe button and turn on the bell so you don't miss tips tailored for men over 60. If this video resonates, type 1 in the comments. If you're skeptical, type 0. Your feedback helps me make better content for you. Let's dive into the first mistake, because what you're watching in private could be quietly rewiring your body in ways you never expected. The first mistake is relying on pornography as your main source of stimulation. I'll never forget Michael, a 69-year-old retired accountant, sitting across from me looking worried. He said, "Doc, I don't feel much anymore, like my body's gone numb." After some honest talk, he admitted he leaned heavily on porn to get aroused. He didn't think it was a big deal until he realized he couldn't respond to real-life moments like a partner's touch or his own imagination. I hear this all the time, men not ashamed, but unaware that porn might be hurting them. Here's the deal. After 60, your brain's dopamine system, the one that handles pleasure and motivation, isn't as sharp as it used to be. Modern porn, with its intense, fast-paced visuals, floods your brain with more stimulation than it's built to handle. Day after day, your brain adapts by numbing itself to cope. A study from Stanford University shows that constant exposure to high-intensity porn can lead to porn-induced erectile dysfunction, or PIED, where you only respond to a screen, not real touch. The result? You lose sensitivity with a partner. Your body slows down. You start feeling embarrassed, thinking it's just age. But it's not age, it's overstimulation. The worst part, many men blame themselves, thinking they're broken. But you can fix this. Cut back on porn. Lean into your imagination. Focus on real sensations, your breath, a gentle touch. Michael tried this, and months later he said, "Doc, I'm starting to feel again, like my body's waking up." Let pleasure come from what's natural inside you. If this hits home, type 1 in the comments to let me know you're with me. Now let's move to the next mistake, because where you do this could be hurting you more than you think. Mistake number 2 is masturbating while sitting on the toilet. This might sound harmless, maybe even practical, but it's doing more damage than you'd guess. I remember Robert, a 67-year-old retired auto mechanic, coming to my office exhausted. He said, "Doc, I'm up 5 or 6 times a night to pee, and I've got this nagging pain in my pelvic area." He thought it was just aging. When I asked about his private habits, he hesitated, then admitted, "I do it in the bathroom on the toilet. Because it's private, the door locks, no one bothers me." Robert's not alone. I hear this from so many men. They pick the bathroom because it feels safe and secluded. But here's what they don't know, that position is quietly harming their body. After 60, circulation is critical. Good blood flow supports sexual function, prostate health, and recovery after climax. But sitting on the toilet, especially hunched over, compresses your pelvic area, cutting off blood flow and putting pressure on your prostate and delicate nerves that get more fragile with age. Stanford University research shows that prolonged poor posture can contribute to prostate inflammation, leading to issues like trouble urinating, dribbling, pelvic pain, or even weaker erections. Robert had no idea his habit was linked to his sleepless nights or discomfort. I've seen it in scans, stories, and follow-ups. This position triggers a slow chain reaction, that makes everything from intimacy to urination tougher over time. The good news: it's an easy fix. Just change your spot, stand up, or better yet, lie down to let your body relax and blood flow freely. Robert switched to lying down, and weeks later he said, "Doc, I'm sleeping better and that heavy feeling's almost gone. Give your pelvic area room to breathe." If this makes you think type 1 in the comments to let me know you're still here. Next up, the third mistake, because rushing through this is stealing the vitality you deserve. The third mistake is rushing the process. This is something I see a lot, especially in men who've spent decades juggling stress work or habits of keeping things quick and quiet. Take George, a 70-year-old retired truck driver who came to me looking drained. He said, "Doc, I just want to get it done, but afterward I feel wiped out, not satisfied." George treated masturbation like a task to check off, rushing through it without thought or feeling. I hear this from so many men, and it's a pattern that hurts more than they realize. After 60, your body doesn't handle pressure well physically or emotionally. When you rush masturbation like you're racing to the finish line, you put your nervous system into overdrive. Your heart rate spikes too fast, blood vessels tighten, and the relaxing hormones like oxytocin, dopamine, and serotonin, the ones that make you feel good and connected, don't get fully released. Stanford University studies show that stress during arousal cuts down these hormonal benefits, leaving you empty instead of fulfilled. George thought he was saving time, but this habit taught his body that pleasure is shallow and rush not meaningful. Over time, you lose sensitivity, struggle to maintain erections, or find it hard to feel joy with a partner. You might think it's just aging, but it's not. It's the habit of hurrying. The fix is simple. Slow down, breathe deeply. Focus on every sensation. There's no race to win, just a moment to feel. George tried slowing down, and weeks later he said, "Doc, I feel relaxed, like I'm rediscovering myself." Let pleasure be a journey, not a destination. If this resonates, type 1 in the comments to keep me posted. Now let's talk about a muscle group you're probably ignoring that's critical to your health. Mistake number 4 is neglecting your pelvic floor. Most men have never even heard of it yet. It's one of the most vital parts of your body after 60. I'll never forget David, a 68-year-old retired carpenter who came to me frustrated. He said, "Doc, I eat well, I work out, but things down there just aren't working like they used to." David thought he was doing everything right, but he didn't know the pelvic floor, the muscles supporting your bladder, prostate, and sexual organs, was being overlooked. I see this in so many patients. They take care of their body, but miss this hidden powerhouse that drives everything from erections to orgasms to bladder control. The pelvic floor is the foundation of your sexual health. When you masturbate without engaging it, or worse, when you bear down or push, you put unnecessary pressure on your prostate and weaken those muscles. Stanford University research shows that a weak pelvic floor can lead to reduced erection quality, urinary leakage, and less intense orgasms. These issues don't hit all at once. They creep in slowly. David didn't realize his masturbation habits, ignoring his pelvic floor, were causing his loss of performance and confidence. I've seen it in countless men. It's not disease, it's neglect. The good news? You can turn it around. Gently engage your pelvic floor during arousal. Think of the muscles you'd use to stop peeing midstream. A few minutes of conscious effort can make a difference. David started practicing, and months later he said, "Doc, I feel stronger, more in control, like I've got myself back." Activate your pelvic floor to keep your strength. If this clicks for you, type 1 in the comments to let me know you're still with me. Next, let's look at how often you're doing this, because that can hurt you more than you think. Mistake number 5 is masturbating too often or not enough. This is a topic many older men shy away from, but it's critical. I remember James, a 71-year-old retired salesman who came to me looking worn out. He said, "Doc, I used to do it a lot, maybe out of boredom, but then I just stopped. Now I'm tired and nothing works like it used to." James had swung between extremes, overdoing it, then quitting entirely, thinking he didn't need it anymore. I hear this from so many men caught between shame, confusion, or the idea that they're too old for it. Here's the truth: after 60, your body needs balance. Masturbating too often, especially out of habit or boredom, can exhaust your nervous system and irritate your prostate. You feel drained, lose interest in real intimacy, and recovery takes longer. On the other hand, stopping completely, whether because of meds, health issues, or guilt, hurts you too. Even without climax, arousal keeps blood flowing to your pelvic area, nourishing nerves and supporting erections. Stanford University research shows that a balanced frequency, about once or twice a week, maintains sexual health and circulation. If you stop for too long, things start to shut down, not just erections, but your confidence and connection to yourself. James felt tired, distant from his partner, and isolated. But you can change this. Aim for once or twice a week, done with awareness, no pressure. James found a balance, and months later he said, "Doc, I've got more energy, like I'm still in the game." Listen to your body to find the right rhythm. If this speaks to you, type 1 in the comments to keep me in the loop. Now let's tackle the next mistake, because how you touch yourself might be causing damage you don't even see. Mistake number 6 is using too much pressure or force. This is one of the most common and damaging habits I see, yet most men don't even think about it. Henry, a 66-year-old retired banker, came to me confused and frustrated. He said, "Doc, I don't feel as much as I used to, and now I'm getting pain when I'm aroused." When we talked, Henry admitted he used a lot of force, gripping tightly, trying to chase the sensation he felt slipping away. He thought it was the only way to feel something. I hear this from so many men. As sensitivity fades with age, they press harder, thinking it'll bring the feeling back. But here's the reality: after 60, the nerves in your penis are more delicate. Using too much force, gripping hard, rubbing aggressively, or leaning on rough surfaces causes tiny injuries you don't feel right away. Over time, these lead to tissue scarring, loss of elasticity, and even structural changes like curvature. Stanford University studies show that repeated heavy pressure can damage nerves and reduce blood flow, causing pain, weaker erections, or even permanent changes to your anatomy. Henry didn't realize his habit was behind his pain and fading sensitivity. This damage builds quietly, and by the time you notice, it's often well underway. Beyond the physical, fighting for pleasure like this disconnects you from its joy, turning it into a struggle. You can fix this. Be gentle. Use a water-based lubricant to cut friction. Henry tried this, and months later he said, "Doc, the pain's gone, and I'm feeling things again." Be kind to your body, it deserves it. If this hits home, type 1 in the comments to let me know you're still here. Now let's talk about the final mistake, because it's about more than your body, it's about your heart. The 7th mistake is masturbating without emotion, connection, or intention. This is the deepest, most invisible mistake, and it's often the most heartbreaking. I'll never forget William, a 73-year-old retired engineer, who came to me with a heavy voice. He said, "Doc, I still do it, but it doesn't mean anything anymore. It's just something to get over with, and I feel empty afterward." William had turned masturbation into a mechanical routine. No feeling, no joy, just a way to push back loneliness. I hear this from so many men in their 60s, 70s, even 80s. They do it out of habit, boredom, or because they think it's just a physical act, no heart required. But that lack of connection hurts them deeply. Here's why: pleasure isn't just physical, it's tied to your mind and heart. When you masturbate without presence, your brain misses out on oxytocin, the bonding hormone, and dopamine, the spark of joy and motivation. Stanford University research shows that mindful pleasure, where you're truly connected to your body, boosts these hormones, lifting your mood and vitality. But when you do it just to get it done, your body learns to expect pleasure without purpose. You might still climax, but you're left with emptiness, isolation, even depression. William felt like he was losing himself, not because of age, but because he'd stripped meaning from the act. This disconnection reinforces the idea that joy isn't for you anymore. But it doesn't have to be this way. Make masturbation a moment of self-love, a chance to honor your body. William started focusing on emotion, breathing deeply, and months later he said, "Doc, I feel like I've found my spark again." Let this be an act of caring for yourself. If this touches you, type 1 in the comments to let me know you're still with me. Now that we've covered all 7 mistakes: relying on porn, sitting on the toilet, rushing through, ignoring your pelvic floor, doing it too much or too little, using too much force, and doing it without emotion, let's bring it all together. These mistakes share one thing: they disconnect you from your body, which is still trying to talk to you. I'm Dr. John Smith, and I'm speaking to you not just as a urologist, but as someone who respects the journey you're on. I've seen too many men struggle silently, blaming age, time, or themselves. But no one teaches us how to care for our bodies as we age, especially in the private corners of life. There's nothing shameful about masturbation. It's a natural part of your body, a way to keep blood-flowing nerves healthy and confidence alive. But when you do it wrong, leaning on porn, using bad positions, rushing or disconnecting, you miss out on its power to make you feel alive. Slower circulation, a more sensitive prostate, a nervous system that can't handle neglect, and a heart craving not just sensation, but meaning. These are what you're navigating now. The good news, it's never too late. Your body is still there, still ready to respond if you listen and care for it. So what's next? Start with my golden protocol. 10 minutes a day of mindful self-care. Breathe deeply, slow down, feel every touch, no pressure. Use a gentle lubricant, engage your pelvic floor, and let pleasure be an act of self-respect. I've seen men in their 60s, 70s, even 80s transform their health, confidence, and energy just by paying attention to their body again. You don't need to chase performance. Just be present, gentle, curious. Your body still feels, still matters, and still deserves care. You're not too old to reclaim your vitality. Your best years aren't behind you, they're in how you choose to live today. If this video helped, hit that like button, share it with a friend who needs to hear it, and type 1 or 0 in the comments to let me know what you think. Subscribe and ring the bell for more tips to live fully with health and joy at any age.